Growing pains in children is not a new concept to most of us. Do you recall having growing pains as a child? Or if you're a parent here, you may have spent time at night trying to comfort your little ones with their growing pain. In this video, we will go over what I think are the most important things for growing pain, knowing how to comfort and soothe your child, and recognizing the red flags and signs that suggest that it may not be just growing pain. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered integrative approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. When does a child get growing pain? Anywhere from 3 to 12 years of age, and the timing can be in the late afternoon, evenings, bedtime, middle of the night. Most children say 1 to 3 times a week, but it could be more, it could be less. And the pain is felt in the calves or in the front of the leg. It could be in one leg or both. And usually growing pains are a little bit more common following a day of active physical exercise or physical activities. And the pain is described as ache, cramping, sometimes throbbing, and it can last anywhere from minutes to hours. And by the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Now, there are some red flags that may signal it's not just growing pain. For instance, having persistent or worsening pain, a fever, limping, and the pain that is so severe that it interferes with normal activity. Pain in the legs in the morning, redness and swelling, or any trauma and injury to the area. And all this is to say, if your child has any of this, it's definitely worth getting it checked out and not just assume that it is growing pain. Home remedies for growing pain. Heating pad, just giving it some heat can help soothe the muscles. Obviously, massaging your child's leg is soothing and comforting. Stretching has been thought to help. Magnesium as an Epsom salt bath or magnesium lotion. Magnesium works on the magnesium-calcium channels to help relax the muscles. So this is thought to help with some of the muscular or leg pain or growing pain. And lastly, over-the-counter medications to reduce your perception of pain. You may consider an ibuprofen, or I think in this case, Tylenol or acetaminophen may be helpful in reducing the perception of pain. Lastly, just to cover a couple myths that I think are circulating around growing pains and what may help. First, vitamin D deficiency has been postulated to cause growing pain. While vitamin D is very important in growing bones and calcium regulation, there hasn't been any good evidence scientifically to show and proven the link between vitamin D deficiency and growing pain. Secondly, it has been theorized that when a child is having rapid growth rate, like in their growth spurt, they're going to have more growing pain again. And when studies looked at this, there has not been shown any significant correlation. If you made it this far, thank you so much for tuning in, and I hope you have some good takeaways on normal symptoms of growing pain and when it's worth more evaluation. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To find out about how you can work with us, click on Become a Member on our website and schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.